In this webinar, we will discuss about the cause of retinopathy of prematurity. The objectives would be magnitude and risk factors for ROP and clinical course of ROP. ROP is one of the leading causes of severe visual impairment in childhood. About 16 to 48% of ELBW infants, 27 to 35% of VLBW infants and 32% of low birth weight infants more than 1500 grams are affected by some degree of ROP. It is important to understand the need for timely screening for ROP to prevent irreversible loss of vision. If you look at the risk factors for ROP, prematurity and low birth weight are the most important risk factors for the development of ROP. Injudicious use of oxygen is also another important risk. Other risk factors include blood transfusions and sepsis. Therefore, the sick and low birth weight infant babies have a higher chance of developing ROP. If you look at the clinical course of ROP, ROP is characterized by the development of new abnormal blood vessels in the eyes of the preterm infants. It begins usually at 31 to 32 weeks of post-menstrual age and progresses over the next 2 to 5 weeks into severe forms. However, ROP does not manifest before 2 to 3 weeks of postnatal age. If you see what happens to ROP scores, ROP can either spontaneously regress to normal vascularization or progress to retinal detachment leading to blindness. Therefore, timely screening is very important. This will detect ROP requiring treatment earlier and avoid progression to severe forms. If you do not treat at the correct time, the blindness cannot be treated later. Even with treatment, you will not get favorable outcomes. So, the key messages about the course of ROP are prematurity and low birth weight are the most important risk factors. Sick low birth weight child has higher chance of developing ROP. Oxygen and blood should be used judiciously. Untreated ROP can lead to retinal detachment and blindness. Timely screening and treatment are mandatory. Thank you.